In the meantime, Prime Minister Andrew Holness says the country is now better able to deal with the coronavirus. Jamaica Maitland tells us more.
Lives versus livelihoods, a discussion which has become all too familiar for countries the world over battling the coronavirus pandemic. And Jamaica is back in the mix after recording an increase in infections, reigniting talks of re-implementing COVID-19 measures which ended in March.
It is not our posture or our position right now to seek to do anything that would disrupt the recovery and the return to normalcy. Already, there are several challenges facing the economy, facing our society, and therefore we have to maintain a posture of being resilient, being able to respond to shocks, being able to respond to crises without causing dislocation or resorting to extreme positions of locking down.
Prime Minister Andrew Holness says the cases are not widespread as yet. Infections have been reported at schools, forcing closure, and at several businesses. But Mr. Holness insists this time around, the country is even more prepared to deal with the virus.
We're now in the endemic phase of the pandemic, meaning that we have to learn to live with the COVID-19 disease. We have had 2 years of managing the virus, the pandemic, and its effects. The population now knows what to do to protect themselves.
The Ministry of Health says it's monitoring bed space for COVID patients.
The hospitals are still returning to routine activities as they are not overwhelmed. You will recall that we had a certain capacity, up to 740 or so beds, even though some have been returned to normal activities, and we are continuing on that trajectory to try and deal with some of the backlog cases.
Of concern, too, is whether there are sufficient resources like ventilators. Last Wednesday, 36-year-old Steve Lawrence died at the Kingston Public Hospital. The family claims none of the life-saving machines were available there, nor at any public health facility in Kingston. Of note, Lawrence did not have COVID-19. Health Minister Dr. Christopher Tufton says he's not aware of the situation and maintains there isn't a ventilator shortage. Jamaica Maitland, TVJ News.
So, is personal responsibility enough? To answer that and more, I'm joined by public health specialist Dr. Alvaston Bailey via Zoom. Dr. Bailey, thanks for joining us.
Thank you very much for having me, sir.
All right, first of all, a few months ago, you predicted a fifth wave of COVID-19, and here we are today. What are your reactions?
Okay, this does not surprise me because the fourth surge started on December 25 and actually ended on March 5, where the positivity rate had peaked to 68.6 and then it fell to 3.3. For the month of April, the positivity rate was roughly 6.72%. So we were doing fairly well. But 7 days after the Easter holidays, the positivity rate jumped up to 12.5, and it has been soaring precipitously since then, with an average positivity rate of 20.5 for the past 17 days. Therefore, we are indeed in a fifth surge. This does not surprise me because with the relaxation of restrictions, one could have anticipated this would have happened because even though we recognize the validity of personal responsibility, when it comes to public health, we have to consider collective responsibility. And public health demands that we take care of each other. And so personal responsibility really is primarily for non-communicable diseases. But when it comes to public health, we have to impose restrictions on persons in order for them to control themselves and prevent the spread to others. And therefore, I think the time has come for us to reconsider the issue of mask mandates, especially in schools, at the workplace, and in enclosed areas to minimize the spread of this.
So, considering that the government has stated unequivocally that they do not intend to reimpose those measures, do you think what is being done now is really enough? Can citizens really be given the decision to take personal responsibility?
I think at this point in time, personal responsibility is not going to work because based on my observation of persons, they really have interpreted the decision of the government as wanton abandonment. And I have found from my own experience that most patients, for example, who I interview, have advised me that they have been told, quite wrongly, that mask wearing is no longer necessary. The government has never said that. They've said that mask wearing should be used if you think you're at risk. But unfortunately, many persons have misinterpreted that statement, and they are now placing other persons at risk, especially in schools, where many teachers have told me the children have told them frankly that they will not wear masks because their parents said they should not wear masks. And in my own practice, I've met many teachers who have become infected with Omicron.
In
And
light of
I've met
this misunderstanding that you're basically telling us now, do you think the Ministry of Health should tweak their message to the public?
Absolutely. It's important that the Ministry of Health tweak their message so that children can recognize that they need to protect themselves and their teachers and their parents when they go to school. This is important, in my opinion, especially also at the workplace, because we are still very vulnerable. It's tempting to think of ourselves as being similar to other countries, but the reality on the ground is that we are only 25% vaccinated, the second lowest vaccination rate in the English speaking Caribbean. And most worryingly, only 17% of the elderly are vaccinated, and they are at high risk. And therefore, we must create a firewall to protect the elderly from getting infected because they are in grave danger.
Okay, thank you very much, Dr. Alveston Bailey, health specialist, uh, speaking with us there via Zoom.